Hi there, and thanks for tuning in to the public report out on the first round of community engagement for the city's spending of American Rescue Plan Act funds. The federal government is giving Richmond two payments of $77 million, 1 year apart, to help our city recover from the COVID-19 pandemic. In this presentation, you will learn why and how the city engaged with residents on this topic, what we learned about community priorities, and what the next steps are for ARP spending. I'm Sam with the Office of Public Information and Engagement. Let's jump right in. On the agenda, we'll talk about the purpose of engagement, how the city engaged with its residents, detailed findings from resident feedback, and the effect of that engagement. First, why did the city ask the public how they would spend $77 million on their city? Well, public input helps us gain a better understanding of resident priorities. We had a good starting off point in certain documents that are very rooted in the community, like the Richmond 300 Master Plan and the Equity Agenda. Thousands of residents provided feedback on both of those documents. But we also wanted to learn more specifically about resident priorities for recovery spending. This initial stage of collaboration will help the city draft its spending plan. Next, methods. How did the city government ask about resident priorities? There were two main platforms for engagement: an English language survey and a Spanish language survey. Totally identical in content, but offered in different languages for accessibility. So, to reach city followers and internet users, we use social media and the city website. Understanding that not everyone follows us on social media or stays tuned to the website, we also used flyers with a QR code to target residents at their homes and in public spaces. The community ambassadors distributed over 5,000 flyers throughout the community. We also visited local businesses to ask them to put flyers somewhere where patrons could access the code. Lastly, we used in-person canvassing. Community ambassadors canvassed RRHA communities with tablets, walking residents through the survey after a training from the Office of Public Information and Engagement. For distributing the Spanish language survey, we leaned on the city's Spanish social media channels, like the Office of Multicultural Affairs' popular Facebook page. To reach listeners of Spanish language radio, bilingual staff from the Office of Multicultural Affairs made multiple appeals on Spanish language radio. And lastly, city staff partnered with the Richmond City Health District's Southwood Resource Center to offer in-person surveys. These methods were used from July 27th to August 9th when the survey ultimately closed. So, what did we learn from this engagement? What did survey respondents tell us? First, it's important to understand who participated. Respondents did represent a broad swath of Richmond, but some groups or areas were more represented than others. Here's an idea of the self-identified race or ethnicity and gender of the participants. Now, not everyone answered these questions about demographics, but we asked them because it's important to see if the data we're getting is representative of our growing and diverse city. You can see that highest participation was in the 5th, 2nd, and 1st districts, respectively, with the 8th and the 9th districts with the lowest percentage of respondents. Some people may not know their district or either work, play, or study in the city instead of living here, and so don't focus as much on their district. At least 78% of respondents live in the city. Moving on from exactly who participated, what did we learn about how the pandemic affected Richmonders? We can tell from an open response question that Richmond is feeling the effects economically, emotionally, and socially. We did a little analysis of those open response answers to look at some common themes. The first of which is that 23% of respondents said they suffered job loss, loss of income, reduced hours, or some other employment challenge. You can pause here to read the comments directly from Richmonders. Some have been edited for clarity, but none for substance. 15% of respondents said their mental health took a toll, citing stress, anxiety, uncertainty, and depression. You can see that some respondents offered solutions, saying that nature was a reprieve and public spaces would help. 12% cited a greater workload, the challenges of working remotely, or the burden of being deemed an essential employee. After asking respondents about the effect of the pandemic, we asked about their priorities for recovery. We asked respondents to rank order 4 main priorities: supporting children and families, transforming infrastructure, neighborhoods, and public spaces, investing in jobs and economic recovery, and lastly, improving government recovery and response. Of the 4 main categories, respondents found children and families to be the most important, which holds across districts and demographics. In this horizontal bar graph, the further a bar goes to the right, the higher it ranked. And you can see we've also broken it down by demographic group. Overall, you can see that priority rankings look pretty similar across groups, with one exception. Black or African American respondents rank jobs and economic recovery second, behind children and families. You can also see that citywide priorities are reflected on a district level. Within the children and family priority bucket, affordable housing, homeownership, and homeless services ranks the highest. Clean and safe water is a clear infrastructural priority. When it comes to jobs and economic recovery, job training and employment assistance take priority. And lastly, respondents rank support for essential workers the top issue for government recovery. We asked respondents to use one word to describe what the money should be used for. It allowed respondents to answer in an open response format, giving us data that helped determine shared values and utmost priorities. Overwhelmingly, regardless of how specific the answer was, residents say they value people, especially kids and the community structures that support them. In fact, 13% of respondents chose kid, kids, child, or children as their one word. Here are the results in a word cloud. You can see kids, children, and families take prominent places. Infrastructure terms like sidewalks, water, and roads are also prominent. We also performed qualitative analysis, grouping words based on theme. Our theme-based analysis shows that 25% of responses called out specific infrastructure and transportation topics like stormwater, roads, and libraries. 19% used words related to supporting children and families like children, childcare, and education. 12% offered words related to housing support like evictions, affordable housing, or homelessness. 11% of responses cited city services and city employee compensation, using words like city employees, essential workers, and pay raises. 5% used words related to public safety and first responders, like community safety, police, and public safety. What's next? How will the city be putting this insight from residents to use? Right now, your priorities are being used to create the draft spending plan for Richmond's American Rescue Plan Act dollars. Our goal: to build back better. And you helped us define what challenges you face and what better actually looks like. Once the draft spending plan is published, we'll explain why the city is proposing these projects and ask you to provide feedback. Thank you for tuning in to this public report out. If you have any questions or want to stay up to date on all things ARP, visit rva.gov/ARP.